If you have low back pain, you have sciatic symptoms with a spondylolisthesis, this video I'm going to show you specifically a routine to where you can stabilize the spondylolisthesis and with the potential of reducing the anterior slippage of the spondylolisthesis. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. And before you do these exercises in this routine, make sure you check with your healthcare provider to make sure this is correct for you. When you look at a normal view of a lumbar spine from the side, the x-ray will show a nice lordotic curve. Now it's optimal that curve is going to be anywhere from 35 to 40 degrees. With spondylolisthesis, it's usually going to have more of an anterior pelvic tilt and an increased curve right at the bottom, and that allows for more slippage of the vertebrae forward. So a spondylolisthesis is where you've had a trauma in the past. It could be a sudden trauma where you fall on your butt real hard. It could be repetitive, like a volleyball player where they're overrunning their sets and they're jamming as they're landing an extension to where it causes repetitive trauma to the joint in the back and it causes a stress fracture. And it's usually right at the area they call the pars interarticularis, and that gets a stress fracture in it. And if you have an increased lordotic curve along with that, then it allows for more of a slippage forward of that vertebrae. The most common areas of slippage will be L5 and L4. And the grades will be anywhere from grade 1 all the way up to grade 4. This routine is for people that have a L5, L4 spondylolisthesis, or it's a grade 1 or a grade 2. First exercise in the routine, we're going to do abdominal curl-ups. You're going to brace abdominal muscles. It's okay to flatten out the lumbar spine during this. You want to lift your torso a little bit, tuck your chin a little more to the chest, squeeze your hands and reach. You want to hold this contraction for a 10 count, then relax. You're going to brace again, and you want to reach, contract, hold that for a 10 count. As it's flexing forward, you're going to cause this reciprocal inhibition of the extensor muscles in the back will help that relax and stretch out more. The goal is you want to do about 10 repetitions. Next exercise is the glutes. You want to do a glute bridge. You want to bend your knees, lift your toes up off the ground, so you're driving your heels into the ground. You want to brace abdominal muscles. Then you want to squeeze the glutes and lift. You don't want to hyperextend your back. You want to keep it more in a neutral position. Squeeze those glutes for a 10 count, and then relax. Brace abdominals, squeeze the glutes, drive up, don't hyperextend for a 10 count, and then relax. You want to do 10 to 20 repetitions. Next exercise, you want to do a lunge. So you want to do a lunge, and it's important when you do this lunge because you want to do a lunge stretch to where you open up the hip flexor. You want to use contract, relax. So you want to brace abdominal muscles so you don't go into extension, irritate the spondylolisthesis. So you brace here, you drive your hips forward, you feel that stress in here, and then when you feel it stretch a little bit, you start driving the leg forward, contract, 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 relax. Go a little further. You want to reach up over your head. When you reach up over your head, don't arch your back, but keep braced in that neutral position. And you want to breathe, hold it about 30 seconds, and then you can relax. The reason why you're reaching up over your head is because the psoas muscle attaches up to the diaphragm also, so you want to get that complete stretch of the hip flexor. Then you want to repeat that. So you're going to try to do it 2 times on each side. Next exercise you want to do is to just hydrate the disc. You want to get the disc moving, all the little joints. So you want to brace abdominal muscles. You want to do some tilts, pelvic tilts, flatten out the lumbar curve and arch it a little bit. And you want to just rock it back and forth. You want to do about 10 to 20 tilts. That's going to heat up that disc, get it ready for change. Then next you want to do is what we call hulas, to where you're just sliding your hips, kind of like a hula, to where you're going to slide it over so the hip will get closer to your rib cage, and then you do it the opposite side. So you go back and forth like a hula. Keep the abdominals braced. Do about 10 to 20 each side. Now when you finish that, we're going to do more of a figure eight. Do a figure eight. And do about 8 repetitions one way, then reverse, go back the other way. You're going to feel some of these areas may be a little sore, hard to move it into that range of motion. Next exercise, you're going to need a block, and the block is designed to be used as a wedge here, where you're going to lie on this, and it's going to cause it to flex right at that joint where the sacrum meets the lumbar spine. So it causes this fulcrum this way. By doing that, it'll help kind of increase that wedge the opposite direction to help allow the weight of gravity and the weight that we put on you to reduce spondylolisthesis. So you come in here, the block shouldn't go any higher than right at the sacral level where it meets the lumbar spine. Then you can use a pad, and then you would place a kettlebell or a dumbbell. You want to start off with 20 to 25 pounds. So it will look like this. Take the wedge, put it right underneath your sacrum. So the sacrum's going to tilt back and open up. Place a pillow. You can get a kettlebell. This happens to be a 26-pound kettlebell. Place it right over the L5 area underneath your belly button, and just let that sit there. Now it's important to just let that sit and breathe. And when it does that, it's going to allow for a creep or a viscoelastic deformation of the ligaments to where it will allow it to start settling back down into alignment and reduce the anterior listhesis. So you need to do it at least 10 minutes. You want to do this whole routine daily. After 6 weeks, if you can go back to your healthcare provider that took x-rays and diagnosed your spondylolisthesis and retake the x-ray and see if there's been any progress in the reduction of your spondylolisthesis. By performing these exercises every day for 6 weeks, you're going to notice typically people have a high rate of decrease in their back pain or getting rid of their back pain and sciatic symptoms. Then when you recheck, you have that potential of reducing the spondylolisthesis.